Hi, this is the nursing professor, and it's Professor Jones, and today we're talking about the GU system, also known as the genital urinary system. So it is a system that comprised of, let's say, the kidneys, the ureters, the bladder, the urethra. It can also have, it also includes reproductive organs, such as for men, the prostate gland, testicles, the epididymis, and external genitalia. For women, it includes the uterus, fallopian tubes, ovaries, vagina, and the perineum. So normally for nurses, we deal with assessing the bladder when we talk about the genital urinary system, and we deal with kidneys as well. So the kidneys, they filter waste from the blood and produces urine. The urine is then carried through the ureters down into the bladder, and then you excrete it through the urethra, and it comes out through the urethra. The purpose of this would be excreting. You excrete toxins because it comes out of the blood and it's made into urine and then it's excreted out. It also helps in volume status, homeostasis, which is what we just talked about a few days ago, metabolism, and sexual reproduction function. So the genital urinary system comprises all of those things. The nursing assessment of the GU system usually focuses on a lot of questions that you're asking the patient. Are they having problems urinating? Any urinary frequency or hesitancy? Urinary urgency? Do they feel like they have to go really bad? Do they have lower abdominal pain, what we call the suprapubic tenderness, or fullness? You also want to look at the urine, and you're looking at the urine for color, which can tell you a lot about the health of the person as well. If it's dark, it could be an indication that they need to have more water on board. They're slightly dehydrated. If it's dark brown, you could think of a liver problem might be going on, or they have severe dehydration. Also, if it's like a pinkish or reddish tinge, then they probably have some type of blood going on, is leaking into the urine, and that's called hematuria. Diagnostic tests that you can see run to assess the genital urinary system could be a UA and CNS. You'll hear it called that in the hospital. It's a urine analysis and culture and sensitivity. And that's just like a basic test that they'll run to see if it looks like, and it's actually looking at the color of the urine. It's looking to see, what's the alkaline level of it? Does it have sediment in it? It's looking for all of those things. And then it'll let it sit for a couple of days. And that's the culture to see if something grows from it. And the sensitivity part of a culture is to see what antibiotic if something grows from it, is it sensitive to? You can also do a CT scan of the kidneys if they're looking at function, as well as a 24-hour urine collection if we think that they're having polyuria, a cystoscopy, ultrasound of the kidney, or renal angiogram. There are many, of course, but those are just some of them. Some of the problems that you could have of the genital urinary system would be renal stones, a urinary tract infection. You can have a kidney infection, pyelonephritis. You can also have enlarged prostate, because that would cause problems with urinating in men, because the prostate becomes so enlarged that their stream is affected. So that can cause real problems. As well as bladder cancer. You can have many things that can go wrong with the genital urinary system. Some of the nursing diagnoses that would be attributed to the genital urinary system would be chronic renal failure, if the person was in failure, and that's when the kidneys just stop filtering as much urine, as much waste products from the blood as what is deemed normal. And so you can be in like a chronic renal failure where you have that all the time. You can be in acute renal failure, which usually comes from some type of insult to your kidneys. There's something that happened. It could be a medication. It could be a disease process that's going on that's causing acute renal failure, and that usually can be corrected. And so those are some of the things that, so you could have a diagnosis of chronic renal failure, or it could be acute renal failure, which is what I just talked about, is if it came on suddenly and it's because of a reversible reason, like an insult to the kidneys. It's a medication. Sometimes you take some medications that are renal toxic and can cause the kidneys to shut down. It can also be when you have severe dehydration. Then again, if there's nothing there to filter, then you're not going to make as much urine. UTI is also a nursing diagnosis that can be attributable to this. Alteration and elimination related to urinary retention, like we talked about the man who could have an enlarged prostate. Infection, you can always have an infection, so that would work. And a knowledge deficit basically works for any system in the body that you're dealing with, because the person who has it always can have a knowledge deficit as to what they can do to prevent it or how to take care of themselves. So there is some information on the genital urinary system.